So obviously, I'm demonstrating the open gloving technique, but this is almost always done right there at your scrub table. So you would be in your gown and gloves scrubbed in from doing this procedure. So you would already have all of this on to get ready to put your band on, right? But since I wasn't really scrubbed and I'm just doing this demonstration, I am doing the open gloving technique. We'll just have my TR band there ready to go. All right, obviously we would have to have pulled back our drape, being very careful not to pull our sheath out. Make sure that you clean off the site. If there's a lot of hem there, then you're gonna just clean it off with your wet 4x4s, dry it, okay? Then we're gonna get our appropriate, didn't really talk about this, there is a large, so there's a basic size and then there is a large. So if you have a patient with a larger wrist, you might have to use the large. This fits most people. I don't want to say normal, but I think it's actually labeled 18 milliliter TR band. And then the large says large on it. You want to pull your sheath out a little bit. Okay. And then you're going to secure your band around the patient's wrist. If we're doing right hand, we're going to place it where the little tubing is towards the hand. And the little green dot is going to be at or on top of or a little bit above, going towards the body, the puncture site, okay? You're gonna have to lift the arm and then secure the Velcro, kind of like a bracelet. And that's kind of what I tell the patient. Okay, we're gonna be putting this little bracelet on your wrist here. And sometimes I struggle a little bit with it just to get it as nice as possible. Okay. You don't want it cutting into them, but you don't want it too loose either. So it's just a nice snug fit. You're gonna get your syringe. Now I will say some people will flush this sheath before just to make sure that there's no clot in there. We do need to talk about flushing a little bit more, and I forgot I do have some red food coloring. I'll bring that next week. I'm not going to test you guys on that right now, but so I want you to actually see blood coming back into the syringe, and we do need to work on flushing sheaths some. I'm gonna go ahead and get 15 cc's. Now some people will tell you to do 18 cc's. The way that we were trained when we first got the TR bands by the rep was to just get 15 cc's in the band. This band will hold 18. And so again, I have seen some people that will go ahead and put the full 18. And then when they're doing patent hemostasis, you know, obviously it still works out to the same. I think it's just easier to calculate if you start with 15 than if you start with 18. Doing the subtraction, I don't know. But again, this is how we were trained. But you could see a little different school of thought on it. Do you start with 18 or do you start with 15? I'm gonna teach you to start with just 15. You're never gonna leave 15 in there anyway, or 18. You're gonna connect it. I like to use my left hand to start putting it in. Use my right hand to actually withdraw the sheath, pull the sheath. So I'm gonna start putting the air in the band and withdrawing the sheath slowly. Okay, you do wanna have it to the 5 mark when the sheath comes out of the skin, and then quickly push that last 5 in. Once we have done that, then we're going to make sure you keep your hand on here, because if you don't, it's going to push out automatically. All right, you're gonna start letting off about a cc at a time. And what we're looking for is a flash of blood right here. This is on a video that I did post for you guys, and you actually can see the flash of blood. So you can go back and watch that video as well. You're gonna keep letting air out until you see that flash of blood. Once you see the flash of blood, then you're gonna put back in 2 cc's. We're gonna say that we saw it at where we were at the 5, and so we're gonna put 2 back in. And then keeping pressure on, you're just going to remove it. Right? At that point, that means that we have 12 cc's of air in that band. All right? Now, when we're going to remove it, so we're going to wait according to Kern. This could be different for the different hospital, the different physician protocol. But for most, according to the book, I'm going to go back and say that again. According to the book, best practice is that if we only did a diagnostic procedure, we're going to leave it on for 30 minutes before we start deflating. If we did an interventional procedure, we're going to leave it on for 90. Remember that they're going to have had more anticoagulation medication if we did an intervention. We're always going to give them some anticoagulation, most likely IV heparin. Even if we're only doing diagnostic, because this is such a small vessel, we don't want to clot it off. And we don't really typically do that anymore in the femoral because it's a larger vessel. But we are going to give some. So again, we're going to give a smaller amount though than we would if we were doing an intervention. But that's why we changed the time. When we go to remove it, what we are going to do is once the time is up, we're going to start removing at 3 cc increments every 15 minutes. Okay? You do want to remember, especially the first several times, there's a lot of pressure in there, and so you want to keep your thumb on the plunger of the syringe, or else as soon as you connect, it's going to start coming out faster than what you want it. You want to be able to control it. So keep your thumb on. And for this one, as I said, you're just kind of let off the pressure on the plunger. It's going to start kind of coming out. Okay, you're going to stop it at the 3 cc and take it off. If we were to have bleeding occur right then, we're going to put that 3 cc's back in. Okay, start our time over. Now we would probably go back to that 30 minutes, but I would always let my doctor know and say, hey, this is what happened. What do you want to do? How long until you want to start deflating again? Okay. 15 minutes up, come back. Again, still having, no, so we started with 12. We've removed 3. That means we have 9 left. Okay. All right. Keeping thumb against. It's still got enough pressure that it's going to try to come out on its own. And kind of release that pressure. At some point, we may have to start actually pulling back. Right, I'm at 3 cc's again, and I'm going to remove. We wait our 15 minutes. Now we're at 6. At this point, I'm going to actually have to start pulling out. Okay. Last 15 minutes, come back and remove the last bit. Okay, when we go to remove, we're just going to, and this will be up to the physician as well, if maybe they want to leave this band on for a few hours or whatever. But if we're getting ready to discharge them, then we are going to take it off. So you're just gonna unvelcro it. And then put a dressing, whatever dressing protocol is at your facility. Okay, very quickly, if we do left radial, we're going to just flip the band. Okay, they don't make a left radial band. So at this point, our tubing is going to be facing the body, and I'll just reach over and show you. And we would place it, again, still the green dot right at the puncture site to a little below the puncture site. and do the same protocol, just having it flipped. Now, obviously, we put this bare. I have this gauze here just so that I can demonstrate a puncture site. We would have no 4x4s, no gauze there. We're going to have it directly on the patient's skin. I want to make sure everybody knows that, so we can see the site. Okay? Good?